closer, introducing the closer. It's always good, Mike.
Thank you, Jay.
Glad to have you here.
Thank you.
So I'm grateful for everybody who helped to put this together today, but we've got a treat for you before you get to go out and have a beer on the veranda. And that is, we're blessed to have Mike Cabonargi, who is the Director of Region 5 for the U.S. Department of Health and Human Services. And he's going to tell us a little bit about that role in just a minute. That's going to be the first thing I'm going to ask him, is to give us a primer on what that is. But he's got basically responsibility for representing and pushing policy of HHS for the Upper Midwest. Prior to joining HHS, Mike has a strong career back as an attorney, both with the Securities and Exchange Commission, but also as a former commissioner for the Cook County Board of Review. So I want to welcome you here, Mike.
Thanks, Jay.
And appreciate you spending time. He's also getting a lot of frequent flyer miles, I understand, in his new role.
Yes.
So Mike, why don't we just start, can you just give us the quick thumbnail on what you do? What's this role all about?
Sure. Well, first of all, thank you, Jay. Thanks to everyone at HMA and all the other sponsors for putting on State of Reform. I know some of my colleagues who are regional directors, and Trell, SEMA, some others have been at some others, and the feedback is always the same. It takes a lot of work to put all these healthcare leaders together, so thank you very much. So my job as regional director is really running air traffic control. In case you're not familiar, HHS has 12 operating divisions and then some staff divisions. So as the regional director, I'm in the office of the secretary, the OS, that's a staff division. The operating divisions, you might be familiar with CMS, FDA, CDC. Some of the ones that people interact with the most might be HRSA. Other than the Department of the Defense, HHS gives away the most money. HRSA has 3,000 grantees and 95 different grant programs. In fact, as I was waiting to come up today, I just got an alert that HRSA and ASPR, which is our Agency for Strategic Preparedness and Response, just gave the state of Illinois $2 million for the Medical Reserve Corps. The MRC is housed within ASPR. Medical Reserve Corps is 300,000 volunteer doctors, nurses, and medical professionals. If you heard during the COVID pandemic when there was a call for volunteer doctors and nurses, they were feeding into the MRC. One of the things we've known, and President Biden has emphasized this, is the resiliency of our healthcare system. And so we're standing up in 33 different states some more funding for the MRCs, and Illinois is going to get $2 million of that.
So again, all those divisions and departments, and I alluded to those a little bit earlier, talking about the emergency response, and at the state level, it kind of mirrors what's happening at the federal level. There are all those different agencies and departments, Mike, and you're kind of coordinating and traffic control.
Sure, yeah. And so I'm the regional director. There's a series of regional administrators for each. So for SAMHSA, the Substance Abuse and Mental Health Services Administration, Dr. Jeff Cody is the regional administrator. For HRSA, that would be Dr. Cheryl Trail. She's a regional administrator as well. Part of what I do is just interact everyone. So the example I probably would give would be about a month and a half ago, we had the train derailment in East Palestine, Ohio with the Norfolk Southern.
Remember that.
And we're still on the ground in East Palestine, and we're not going anywhere anytime soon. EPA is team lead on that, but from HHS, we immediately sent out ASPR, our Agency for Strategic Preparedness and Response. They're our emergency responder for healthcare needs. We sent out our Agency for Toxic Substances and Disease Registry, ATSDR. ATSDR does all the environmental testing as it relates to health. So our ATSDR people are in East Palestine right now. They immediately set up air monitors in town. They went door to door and knocked on doors, and anyone who wanted a water monitor for their well water got one put in. We have soil monitors in the ground at the crash site, but also around town. So ATSDR is going to be on the ground. And then we also send a team in from SAMHSA to do some stress and trauma-based mental health assessments. We just set up, I shouldn't say we, a local hospital outside of town set up a clinic in downtown East Palestine, and we're looking at how to best serve the community long-term for their behavioral health needs. That might be telehealth, that might be actually having physical providers there as well, but it's just a great example. Each of those organizations within HHS have to work together, and that's kind of my job, is to make sure that everybody's talking and sharing information. East Palestine's a great example. It's in Ohio, but it's 10 miles away from Pennsylvania. It's 30 miles away from West Virginia. So that's 3 governors, 6 senators, and 13 members of Congress. And you have to coordinate all of their needs at all times. But I just hats off to the folks in that town for their resiliency. They have an extraordinary mayor and local leadership.
Yeah. Well, so you alluded to obviously the biggest historical hump that we've gone through in my lifetime, which is the pandemic. And so talk to us a little bit about, I believe you weren't in your role at the beginning of the pandemic, but you certainly joined, kind of while things were in full throttle. And so I wonder if you can talk a little bit about, both the response, but also the end of the public health emergency and what's going to be happening.
Yep. Full disclosure, I'm on month 4 of being the regional director. The White House appointed me in February. As Jay mentioned before that, I was a county commissioner in Cook County. But as we're looking at the end of the public health emergency, which expired on May 11th, in a couple of phases. Looking back, we see that in the past 2 years, it was the largest vaccination program in the history of this country. Over 270 million people received a vaccination. Over 229 million people received both doses. More than 52 million people have received the bivalent vaccine. We've learned a lot of lessons from it. I just pulled some numbers together to see where we are with our numbers. Since the end of January 2022, daily COVID cases are down 90%. COVID deaths have declined by 80%. New COVID-19 hospitalizations are down by 75%. As we were wrapping up, and I think we talked about this earlier, Jay, as we were wrapping up the public health emergency, one of the things that President Biden wanted every single agency to do was to do an after-action report of lessons learned so that we can be prepared for the next time. And we realized so much of it was the outreach. We went into barbershops, we went into churches, we worked with faith communities. We stood up in the end over 90,000 different vaccination locations, 90,000 places in a short amount of time. We went to places where people were, we spoke the language they wanted us to speak, and we delivered the vaccine in the way they wanted it delivered. So looking forward on the preparedness side at HHS, we're really focused on 3 things. Improving the data and early detection. That would be diagnostics, tests, and a lot of our wastewater testing, including the constructions and the long-term support of local labs. We've got a lot of labs that sped up their processing to take care of COVID. We want to make sure that as they move into other fields that they still have the bandwidth to do additional testing. Strengthening the supply chain and countermeasures, testing, vaccines, therapeutics, as well as increasing domestic production and then workforce recovery. Just last week over at the Harold Washington Library, ASPR had a 2-day conference on the Strategic National Stockpile, the SNS. Yeah. If you're familiar with the SNS, it really got a stress test during the pandemic. Yeah. We had for all 6 states in my region, and in Region 5, where we are now, the Great Lakes region, it's Illinois, Michigan, Indiana, Ohio, Wisconsin, and Minnesota. We had the state directors who deal with medical emergency preparedness there to kind of run through what's available with the SNS. It was great. It was the first time these professionals had been together. And I think people think that, well, it's great, but we're not going to have another need for this. 3 weeks ago, we saw that there was we had 1 positive exposure of Mpox, formerly known as monkeypox, in California, 1 in Texas, 23 cases here in Chicago. So the CDC out of Atlanta immediately sent an epidemiology team here to Chicago. They're housed outside with the Chicago Department of Public Health. And we just put together all of those things we talked about that we learned from COVID. Do we have enough vaccine? In this case, the Jynneos vaccine. We filled it all in the SNS pipeline. We brought all the state leaders together to say there's plenty of Jynneos vaccine in the SNS. Draw it down when you need it. Do we have enough distribution systems? Again, those 90,000 vaccination locations, are they stood up and ready? In this case, yes. We know that Mpox primarily affects the gay men community, so we've got Howard Brown and other community leaders on the ground. And the third piece would be the public education campaign. So, because again, we know the community that's most hit by Mpox is gay men. We've got coasters and napkins in gay bars. We've got paid communications on Grindr. We've started geofencing around for Pride Month, a lot of activities and events. We know that what we've learned from COVID, we're going to be using over and over again.
Yeah, it's interesting. And again, having the blessing of having a front seat to see the condition of the stockpile at the beginning of the
Sure.
of the pandemic. It was a real eye opener, and part of the thing that I think Mike's alluding to, this concept of learning organization. Can you pick up and learn from those other pieces? I want to bring us back to some stuff that we've talked about earlier today here. So we've had some sessions today on access and quality in maternal health care. We've had a session on the 1115 waiver, and it's interesting when some colleagues at HMA were, sensitizing us all to the 1115 waiver coming out of the state, the application coming out of the state. They pointed back to the 2021 release from CMS saying, get going, let's change this, and let's start approaching the social determinants of health. So I wonder if you can talk again about how policy, whether it's in the White House or whether it's at the departmental level, how does that get kind of pushed through the system? And maybe you could use the example of maternal health outcomes and inequalities there.
Sure. Well, it really comes from the top, from the Biden-Harris administration and the White House and the domestic policy team, and also the leadership of Secretary Becerra. Maternal health, first of all, we start with the data. The maternal health numbers are not where they should be in this country. We follow behind the rest of the developed world and where we should be. Equalized for income and education, geography, black women die at a rate 3 times higher than white women giving birth. The long-term numbers aren't where they need to be. So HHS has put a lot of money into grant programs for education of providers, doctors, and nurses, so we can remove some of that implicit bias that we're seeing in the medical profession when they're communicating with black women who come in through the process. A lot of that is, as we've all talked today, about workforce recruitment and retention. But then also realizing it's not just the physical health, it's also the mental and emotional health. We were just excited, Secretary Becerra and the President just celebrated the 1-year anniversary on Mother's Day of the Maternal Health Wellness Hotline. So last Mother's Day in 2022, HHS stood up 833 TLC Mama, 833 TLC Mama, which is a maternal health hotline. It is not a referral line alone. There's actually trained medical health providers on there, doulas, peer advisors, and what have you on there to provide direct help. Because as we know, as a new parent, and I'm a parent of 2 kids who are no longer babies, it can be a stressful and isolating experience. So this hotline was put online to help. And we just got the numbers back. I think we said in the first year, we responded to nearly 12,000 calls. 70% of those were phone calls, 30% were texts. The hotline is in English and Spanish with translation services for more than 60 other languages. And when we ran through the data points, it was interesting. The number one reason people were calling wasn't necessarily depression or postpartum depression. The first reason was overwhelmed. 75% of the people who called were the parent, 25% were the people around them who were calling to report this person was underwhelmed. I just left my son who's a new dad, he seems overwhelmed. I just left my sister's house, it's girly, she hasn't slept. They were calling out for help and they needed help directly and they needed to know how to work with their loved one. So Secretary Becerra has upgraded the hotline. We're gonna be hiring more operators and expanding and scaling it up and getting it out into more communities. So, long-winded way of saying, like, what do? We know what we need to do. We just can't be afraid to experiment. And this is one experiment that worked out really well.
Yeah, and hopefully not being challenged by people who might believe in reverse equity and issues of that nature. And we had one session, I have to apologize, I wasn't able to sit in the session today about rural challenges in Illinois. But again, when you look at the demographics of the country, they're constantly changing. Yet the commitments that come out of the federal government have to be focused on equity as best they can, and sometimes that's race, sometimes it's class, sometimes it's place of residence. How is the government looking at strengthening access to care and quality of care and frankly just service provision in rural areas?
That's a great point, and you use the phrase equity. Sometimes we forget that the equity lens can also go to rural healthcare as well. Rural healthcare can be different than other types of healthcare. I was just in Madison, Wisconsin a couple weeks ago meeting with the AARP there, and they flagged an issue that I know we talked about here, which is they have a senior population that's undergoing a lot of isolation and depression. They need access to mental health counselors, but they may be in rural parts of that state where they don't have physical providers there, so they'd like to move them to a telehealth operation. But there are parts of the states that are victims of the digital divide and don't have broadband access. So again, all of this works together. The Biden-Harris administration has preferenced rural areas for development of broadband first because it's so key to everything else happening. Also, I just pulled some numbers together. Just wanted to see what we're doing in our rural health programs. We just put out $110 million to reduce morbidity and mortality from substance use disorder with the ongoing public health emergency for opioid and fentanyl abuse, including a new $24 million line for rural communities to train first providers how to use Narcan, how to operate test strips, overall harm reduction strategies. Just put another $55 million in the Medicare Rural Hospital Flexibility Grant, and then also $11 million in the new rural residency planning and development program. In addition to some of the grant programs, and we were talking about before, is we heard from folks about keeping our rural hospitals open. Between 2010 and 2018, about 140 hospitals closed or ceased providing direct care. We saw in 2020 and 21 that thinned. Less than 10 hospitals closed. I think 10 hospitals closed total in 21 and 22, I think largely because a lot of the COVID funding was still available for them. But at the beginning of this year, we've seen how many hospitals closed? So I think we saw 40 have closed since the beginning of this year.
And be glad you're not the regional administrator from Mississippi. I think the last report I said, half of the rural hospitals there were going to close.
Yeah.
I shouldn't say we're going to close. We're threatened to close. So I think that one of the things that makes me scratch my head after talking with you last night and the past week is this balancing act. So we talked about it with Deputy Governor Flores this morning about you've got 58 different things going on at the same time and trying to focus on the equity part of this. We've got two other areas that I thought we might touch on briefly. Again, I think they come out of the administration's equity focus, and one is around mental health and substance use disorders, and the other is around, the astonishingly high number of people that we have in the country that are incarcerated and maybe at some point are going to come back out and rejoin the community. So I wonder if you can talk about those two, again, mental health and the justice-involved population, and how do you blend strategies to improve health status for those populations and equity?
Sure. It all comes back to just listening to what our state partners and our local partners want to do and have tried. I'm so excited to hear from Teresa and her team that they're planning to do an 1115 waiver for 90-day pre-release funding and putting some other things in there. California's got a great template of what they've done, being not afraid to experiment as well. I think it really comes from what we're being asked to do for what worked. A lot of what Secretary Becerra focuses on is our data collection. He created a department in the Secretary's office, again, another staff division, on data collection and social programming. We've got 4 PhD data scientists who look at everything through an equity lens. They go through the budget, they go through programming, they go through personnel and FTE loads to make sure that we never lose sight of our equity lens, because it's just the focus of so much. And as we've all talked today, so many of these threads run through everything: workforce development, mental health, behavioral health, substance use disorder and fentanyl abuse. When you're at the regional director level, you just see all those pieces together and how they should be working and complementing one another.
Yeah, it's interesting. Some of us at HMA had an opportunity a year or two ago to do some work for some foundations around gun violence. And it's the same kind of thing where getting the information that will inform things when you've got a circumstance where gun violence turns out to be the leading cause of death for children. Sure. and things of that nature. And so I think that data information part is key. And I wonder, Mike, if again, coming back to just your role, when you when you're spending your time, and I know you've only been in the role for a little bit, but when you're spending your time in these different states, who or what are you most interacting with? You know, which of either the departments or the leaders are you in your role interacting with?
Right. We look at it as who are our stakeholders and who are kind of our kitchen cabinets. So then that's part of what we're building out now with our team right now, is to know what's our kitchen cabinet for reproductive rights? What's our kitchen cabinet for Medicaid recertification? Who are the folks we need to talk to? So for example, over the past 3 weeks, we've done 5 stakeholder calls, 3 for Ohio, 2 for Illinois about Medicaid recertification. Our great CMS regional administrator, Pam Thomas, organizes them. For Illinois, we had faith and community leaders on to talk about it. Again, these aren't our state partners because they're on the ground really doing it. And again, hats off to Illinois for doing, from what we're seeing so far, a phenomenal job on the recert process right now. Really creative, really innovative, really committed to making sure that the number that's been floated out there is there's a risk of 15 million people nationally losing their coverage. Illinois wants to make sure, as you can see, everybody either stays in Medicaid or moves to a marketplace solution. So, you know, our stakeholders and our kitchen cabinets, you know, when every time I go into a state, Jay alluded to it, I've been on the road a lot. This week I was in Columbus on Monday and Tuesday. They have a 2-day conference on opioids. Met with their state health commissioner, the city of Columbus health commissioner, the Franklin County health commissioner. You see trend lines, and that's a lot of what I have to do is uplift it to the secretary.
Yeah.
The problems that folks are having in Minnesota and rural areas are the same we have in central Illinois. They're not all that different. But what are some of the solutions that are working? Detroit is a great example. We met with the Detroit Area Agency on Aging, the AAA for the city of Detroit. And I was talking to them about how are they working on Medicaid recertification. And they operate the largest in-home care providing service. It's a public-private partnership. One of the things they did was when the person comes into the home every day to check in on that person, have they eaten, give them their pills for the day. They have a kind of a start of day script. The very first thing is, did you get anything today from the state?
Let me see your mail.
Let me see your mail, you know? Michigan is doing a blue envelope. Minnesota prints purple, which is pretty cool. That's part of their welcome script. When you get in the house, the first thing, let's look for the mail. Nobody told them to do that. That was not part of Michigan's CMS plan, but they just said, we're in the house every day. It's the first thing we can do.
Well, you ought to whisper that in the ear of your colleague who's doing Florida in the Southeast. I mean, I want to just reflect something. If you all were here at noon and you heard Director Eagleson talking about that 51% preservation at redetermination, and I had seen a study last week or 2 weeks ago, I think Kaiser did, something like 85% of 250,000 people who lost Medicaid coverage in Florida, Laura, keep me honest on this, they qualify for it. They're eligible for it. But they did not prepare in the same way, and so I think we've got reasons to be really grateful for some of the leaders in the state that are helping to preserve that critical access to care.
And just so everyone understands, two years before the expiration of the PHE, every state Medicaid office had to give a plan to CMS for review and approval of how they were going to execute it. It really does happen at the state level. Ohio pushes a lot of it to its county system because of the way their home rule works. States can be different. Illinois has been really aggressive. The ex parte number that Teresa mentioned was just phenomenal, that right off the bat, because of data collection being good, it's just such a smaller universe to go chase after once the ex parte number comes down.
Excellent, excellent. Well, listen, we may have time for one last question, but it's a timely one for us here in Chicago, and that is, you know, we've seen now some 10,000 people come, sometimes called the New Americans, sometimes called refugees, sometimes called immigrants, but this influx. So talk a little bit about the role and how, in your role, you're able to help, whether it's the mayor or the state.
Sure. First of all, we start with the fact that we're all from somewhere else. I mean, my dad came over when he was 18 years old from Italy on a boat, where he realized two things. He wanted a better life, and he had never been in a boat before, so he immediately got seasick for 2 weeks. Not his best moment. But as we look to these folks who have traveled through deserts, through jungles, because they want to be Americans, keep in mind the 8,000 people that have come through Chicago so far are refugees and asylum seekers. They have come through the legal process. The Biden-Harris administration is committed to making sure that they live a healthy, dignified life here while they're waiting for the legal process to play out for them. The lead really is the Department of Homeland Security. The other federal partners that are leads are FEMA, and then HUD for long-term housing for them. Most of what HHS does is through our block grants or our community block granting. But we do have some specialty grants that have stood up that we've talked to Mayor Johnson's office about. There's serving trauma-afflicted refugees, the STAR grant program that we've got outstanding right now through SAMHSA. We've got a number of other ones. FEMA, I pulled the numbers together. Last year, FEMA, through its food and housing grant, I think gave Chicago $5.6 million to date. In this year, through 2023 to this date, I think it's $4.8 million. Obviously, we need more. But all the federal partners are committed to making sure that these new people have what they need while they're here in the United States. Specifically in HHS, we have the Office of Refugee Resettlement, ORR. That deals with that subset of unaccompanied minors who have been processed through and are in the custody of HHS while we find a permanent sponsor host for them. That's a program that we're always looking to improve. But that's the idea. We don't want these young children staying in these border tent cities for any amount of time. They're brought in, they're processed, and while they're in the custody of HHS, they're in school. They have 3 times a week they can get on the phone and make a call to their family. They have twice a week sit-downs with mental health counselors. They're getting a full group of assortment of wraparound services while they're in the custody of ORR.
Fabulous. Well, I feel terrible that we've got only the small amount of time that we've had, but I'm grateful, Mike, that you were able to find time in your busy schedule. And it strikes me as I'm hearing this, you've been on the job for 4 months, and I'm thinking, boy, those lawyers are good at reading a lot really fast and like getting it. Like, you'd probably embarrass medical students, you know, they can get that knowledge down and incorporate it so quickly. And I'm grateful for that. I'm grateful for your service, Mike.
Thank you.
So thanks very much.